what you got? Hi JJ, what happens at tummy tuck consultation? Well, we assess you to see if you're a candidate for a tummy tuck, because that is weirdly people with a good abdominal contour, or at least without a significant amount of excess, might not actually be a candidate for a tummy tuck. So people who are candidates for tummy tuck have a lot of excess skin, usually weight loss or childbirth. Usually they've had one or both of those problems, and they've got too much excess skin. So we need to assess you to see whether you are a candidate for a tummy tuck, and what sort of tummy tuck. So full or a mini. So basically, I guess you could do a mini on anyone, but you can't do a full tummy tuck on anyone because you need to have a certain degree of laxity. So some patients are actually more difficult if you've only had like one child or only a modest amount of weight loss and you haven't got a huge amount of spare skin. It might be like, crikey, I'm not sure I could even offer you a full tummy tuck. So we need to, so we might be then talking about mini tummy tucks and what that's involved, the limitations of that. So one part of the consultation is us assessing you to see what sort of tummy tuck you might be kind of eligible. Is that the right word? You know what we might be able to do for you. And then the other side of the consultation is kind of letting you know what that can achieve, what the risks of that are, and what the benefits of it are, to see whether that would be something that would be attractive and something that will be worthwhile doing. So as I say, this one side is us assessing you to see what we can do, and then we need to explain to you what we can do and what the benefit of that will be, and whether that would be a good thing for you to go ahead with. I guess in a nutshell, that's what's involved with the tummy. So what physically happens is we take a history and examination. So we talk to you, we say, what's the problem, what problems are you getting from it, what are what's your history in terms of weight loss and things, where are you with your weight. We need to make sure that you're stable and comfortable with your weight. It's not really good if you're still overweight. If you want to lose weight, it's not good to think about a tummy tuck. Past medical history, you got any medication, you're allergic to anything, have you got children, have you got any plans for the future for children, or weight fluctuations, are you happy with your weight? Because if you're not happy with your weight, you're better off getting your weight right first. If you think of having future children, it might be better to do that first because it could affect the result. And then we'll assess you and examine your abdomen and have a look at, as I say, whether you'd be a suitable candidate for it. So yeah, that's kind of what happens at a tummy tuck consultation.